Now we will discuss regarding the motor nerve supply of the soft palate. All the muscles of the soft palate get their supply from the accessory spinal nerves through the pharyngeal plexus, except the tensor veli palatini muscles, which is the muscles of the first branchial arch, so receives the nerve supply from the mandibular nerve through the otic ganglia without relay, and it gets supplied from the nerve to the medial pterygoid muscles. And about the sensory supply, the nerve supply, that is the general sensation nerve supplies, is carrying through the greater palatine and lesser palatine nerves and through the glossopharyngeal nerves. And about the special sensory supplies, the nerve fibers are carrying via the lesser palatine and as well as the glossopharyngeal nerves from the oral surfaces. The secretomotor supply is coming from the superior salivary nucleus through the facial nerves and through the greater petrosal nerves, and it reaches the pterygopalatine ganglia, and there is a relay, and the postganglion fibers come through the soft palate via the greater palatine and the lesser palatine nerves. Now the soft palate gets blood supply from the greater palatine artery of the maxillary artery, and not only that, it gets, you see here is the pictures of the soft palate, it gets supplies from the ascending pharyngeal arteries as well as the ascending palatine branch of the facial arteries. And nerve venous drainage is through the paratonsillar veins to the pharyngeal venous plexus. The lymphatic drainage of the soft palates, the lymph drains into the retropharyngeal parts of the lymph nodes and ultimately deep cervical parts of the lymph nodes, retropharyngeal parts of the lymph nodes and ultimately the deep cervical parts of the lymph nodes. Now here we are in the positions to discuss regarding the compositions of the palate. Okay, you see, we have told you that the soft palate is the double mucus covered hanging curtains. So towards the nasopharyngeal sides, it is covered by the mucous membrane of the nasopharyngeal parts. After that, it consisting of the some palatine glands. Then there is presence of the anterior and the posterior fasciculus of the palatopharyngeal muscles receiving the insertion of the levator veli palatini muscles. After that, there is the palatine aponeurosis, which splits to enclose the musculi uvuli muscles. Palatine aponeurosis is nothing but the fibrous framework of the insertions of the tensor veli palatini muscles. After the palatine aponeurosis, the palatine glands, another sets of palatine glands are present, and within the oral surfaces there is presence of the mucous membrane of the oral cavity. So the mucous membrane of the nasal cavity, then the palatine gland sets, then the three muscles fasciculus. One is the two fasciculus, anterior fasciculus and posterior fasciculus of the palatopharyngeal muscles, and in between these there is the insertions of the levator veli palatini muscles. There is the palatine aponeurosis, the framework of the fibrous frame of the tensor veli palatini muscles, which splits to receives the musculi uvuli muscles, then another sets of the palatine glands, and lastly another mucus covering of the oral cavity.